It's great for having me. Kemper has told me so many great things about this group. I've been in Ann Arbor for the past 25 years. Know about Rob, know about LeadersConnect, and so when Kemper and Rob asked me to come out and speak, I was really excited to come talk about this topic. And so, for starters, I want to start with a couple of important pieces of context. The first piece of context I want to start with is that when I say healthcare is broken, and I think when we kind of a society say healthcare is broken, I do not mean that the people that work in healthcare are broken. I think people that work in healthcare are some of the most compassionate, caring people on the planet that do an incredibly hard job under incredibly hard circumstances. I'm talking about the systemic flaws in our healthcare system that are broken. And that's really what part of the conversation is going to be around today. I think in spite of the challenges systemically that exist in healthcare, I think our healthcare providers do an amazingly valiant job trying to keep people healthy. The other important piece of context is this is a massive, massive topic. And we're only going to be able to talk about little bits and pieces of to this topic this morning. And we're certainly not in this room here today going to solve the healthcare crisis that we have in this country. But what I would ask all of you to do as we move towards the end of the presentation, I'm going to provide some suggestions of things that you can do. Maybe big things, maybe small things. But if you could take one thing out of the presentation that I give today and go back and implement it in some aspect of your life, I think that would be an amazing win for Friday morning. So with that said, I want to tell you a little bit about the perspective that I bring into this conversation. And I'm going to start with a very macro perspective, and then I'm going to drill down a little bit more specifically with some of the different hats that I wear. I believe that access to affordable and effective healthcare is a fundamental human right, full stop. That is something I believe very, very deeply. If you do not have your health, you absolutely do not have anything. So that's my broad perspective that I bring into this. Now, more specifically, I'm going to talk to you about the different hats that I wear and how that's going to influence what I'm going to talk to you about today's conversation. I'm also not going to hit that button. So the first hat that I wear, and Kemper alluded to this, I'm the president of a national nonprofit called the Physical Activity Alliance. We work with the federal government on physical activity policy and systems change. So that means we do any number of things from working with the Office of Disease Prevention and Health Promotion is CDC, to roll out the National Physical Activity Plan, which is the implementation plan for physical activity guidelines for Americans. We also work with CMS, so the Centers for Medicare and Medicaid Services, on how we embed exercise more directly in health share. We have a program that we're working with CMS on that would make physical activity and exercise assessment, prescription, and referral the standard of care in healthcare. We've worked with a federal agency to require that starting in 2028, physical activity will be a required vital sign inside of electronic health records. And we're currently working with CMS on the benefits designed for supervised exercise therapy delivered by exercise physiologists. So basically, physical therapy for chronic disease. The federal government, specifically CMS, is very interested in how we bend the healthcare cost curve, and they're realizing that lifestyle factors, and we'll talk about this today, play a big role. So that's one hat I hit the button again. The other hat that I wear is I started and run a state-level nonprofit that is working with the Department of Health and Human Services on rolling out a state-level physical activity plan in local communities. We're actually launching that on the steps of the Capitol on May the 12th, and it's a very, very exciting public-private partnership. As Kevin mentioned, I'm the founder of Applied Fitness Solutions. So at my core, I am a leader. That's what I do most during my days. I lead our organization. I'm a leader. I'm an entrepreneur. I'm somebody that believes deeply in the work that all of you do as leaders. And at my very, very core, I'm an exercise physiologist. So that is my clinical background. It's what I studied in school. I taught it at U of M. And I'm somebody that believes in the power of movement. This is not going to be a presentation around why we all should be exercising. We'll touch on that a little bit. But what I will say is that I believe there's nothing more impactful you can do for your health than move. The Federal Physical Activity Guidelines say that if you move for 150 minutes a week at a moderate to vigorous intensity, you're conferred significant health benefits. I challenge you to tell me one other activity you can do for only 150 minutes a week and get significant health benefit. If you only slept well for 150 minutes a week, you only ate well for 150 minutes a week, it doesn't do a lot for you, right? So I am definitely an evangelist for movement, and that is going to make its way into the end of my presentation. So I take very much a socio-ecological perspective to how I view change, because change in our world is hard, especially change in healthcare. So the way I think of it is, how do we drive change from an individual level? So in ourselves, how do we model the change we want to see in the world? An interpersonal level, how do we do it with our families and our closer communities? How do we do it at the community and organizational level? So how do we help make our organizations healthier? And then lastly, how do we influence policy at a societal level? And so I'm going to try to talk on all these levels today. And I fully realize, as I said, healthcare is a big, hairy topic. It's complicated. It's politically fraught. And so there's a lot of challenges. So maybe you're not somebody that wants to engage on the policy level. Absolutely fine. Find the level that you're comfortable with and try to engage on that level. And hopefully I can provide you some suggestions today about how you can engage on all these various levels. So I think a fundamental question to ask is, what is the purpose of a business leader? Is it to drive profitability? Is it to generate return for investors? Is it to increase market share, serve customers, cultivate innovation, drive societal change? Is it to create wealth? My perspective, and I think probably the perspective of a lot of people in this room, is that it's to take care of the people that follow you so they can do all of those great things. I think great leaders take care of their people fundamentally, and that's what they do. And in some sense, I think leaders create wealth by creating healthy organizations. And, Gandhi will remind you that health is our greatest wealth. Right? Sometimes when we're healthy, we don't think about these kind of things, right? I think we often, take our health for granted. I'm going to take 2 minutes here to tell you a story that really crystallized this for me. A young man started working for us, this is probably 14 years ago. Rising star in our organization. Great young man, started very introverted, became more and more extroverted over time, made his way up to the ranks, actually met his wife at my organization. Turns out he had glasses that have to have that Schrager Iderov. And he was a rising star. But got to the point of being a general manager. And then he was diagnosed with a rare form of cancer. And within 2 years, he passed away at the age of 30. That was just this past fall. It was an absolute tragedy. And I'm fortunate in my life to have not had to deal with that kind of tragedy. But it really struck me of how if you don't have your health, you really, really don't have anything. And I think, when you're younger, you take health for granted a lot. And so it was just one of those moments where I was like, this guy was going to have equity share in our company as we grew. He was going to have a great career, and then just slam shut by cancer. And so health is everything. So I'm going to frame this up in this concept of the double bottom line: healthy profits and healthy employees, because that's ultimately what we're talking about here. And I'm going to start by talking about employee health care. Who in this room purchases health care for their company? Anybody you called in healthcare purchasing? Okay, a couple people, right? All right. We are all purchasers of health care to some degree. We all interact with health care. So we're going to talk about a couple things with regard to employee health care that even if you're not purchasing it, it absolutely affects you. Who has seen their deductible on their health care plan increase over the past 5 years? Okay, it's pretty much every hand in the room, right? So one way or another, we are all paying for healthcare. So this tracks employee healthcare costs employer healthcare costs since the turn of the century. So this takes you from basically 2000 all the way up to 2025. And at present, employer healthcare inflation is sitting at about 8 to 10%, depending on what kind of a plan mix you have. I am involved in our purchasing decisions for healthcare at AFS. Our plan went up by 11% this year, right? I'm sure those of you who are purchasing the health insurance probably saw something similar. A lot of people saw that across the board. So employer healthcare costs are going up far greater than the rate of inflation. Like, we hear all this talk about inflation, and we're at 2.4%, we're at 2.6%, everyone's losing their mind. Can we get it to 2%? Healthcare inflation is above 8% and has been for a while. And the scary part about this graph is the question that I think of whenever I see these graphs of cost of healthcare utilization. I'm like, are we getting less healthy or more healthy as a population, right? So, like, what starts to happen as we get off the screen to our healthcare costs? And employees are paying well. You know this. You just raise your hand, right? Because there's a finite amount of money that can go towards employers paying this escalating cost. So, maybe they're passing it on to the employees in the form of higher deductibles. And so, family health care costs are also increasing. So the cost factor is very, very real. And we're spending on chronic disease. So we spend about $5.5 trillion annually on healthcare in this country. The vast majority of that spent, $4.41 trillion by the latest figures, are spent on chronic disease and mental health. So not acute care, not maternity care, certainly not prevention, which is probably part of the problem, and administrative policy. It's spent on chronic disease and mental health. And that is problematic, but the good news is there are some solutions that we're going to talk about. From just purely a business perspective, and I almost didn't put this slide in here because I feel like this is like patently obvious, but I thought it was important to put it in here. The more somebody accumulates chronic diseases, and the vast majority of our population has many comorbidities. So it's rare that you just have one chronic disease. It's more common that people have multiple chronic diseases because they're all interrelated. The more chronic conditions you have, the greater increases your likelihood of absenteeism from work, right? If you're sick, you can't come to work, can't do your job, obviously that's a problem. But the bigger issue is the economic cost associated with what we call presenteeism, which is showing up to work, but not being at your best, not doing your job as best as you can, right? So this is data from the Ikon Institute that suggests that of all the costs that are associated with chronic disease where we lose economic output, absenteeism is not a small number, $127 billion. Caregiving, meaning somebody else is ill, so you have to be with them, that's $91 billion. But presenteeism, we're talking about nearly $830 billion. And we didn't just figure this out. This data from the Ikon Institute was published back in 2009. So chronic disease is zapping the productivity of our workforce. Look, any of us who has been sick knows that if you're sick and you go to work, you're just not performing your best. Like, I'm not telling you anything here that is earth-shattering, but I think the economic impact of this is pretty interesting. Now, what's also interesting is the way healthcare works in this country. And I'm going to refer to this as the Great American Healthcare Experiment. And that might be a little unsettling to you, but after you hear about how we got here, you're going to find out that it very much is an experiment. So if I put a graph up here for any other country on the planet, it would not look like this. The mix of how we pay for healthcare. So you see the right side of the circle, about half of the healthcare in this country is paid for by employers. And then the other half of healthcare in this country is part paid by the government, so that's Medicare and Medicaid, and then the military for TRICARE. And then, unfortunately, we had a very large segment of our population that is uninsured in this country, which is very problematic. But any other any other country on the planet, but this would be one big circle, and it would be the government as a payer of healthcare. America stands alone in this concept of employer-sponsored healthcare. How did this happen? How are we such an outlier? Now, I know I believe firmly in our democracy. I think I benefited so much from being born in America. I'm so grateful to be here. And so there's a part of me that wants to think, well, damn it, America, we just did it right. Yeah, it's exactly, right? So how did we get here? How did the great healthcare experiment happen? Well, World War II broke out, and in 1942, the federal government said, hey, we got to send a bunch of people off to war, so we can't have all the rich companies paying workers a ton of money to work for them. So, because we don't want to ruin our economy, we need the workforce to be spread out. So they basically froze wages for the entire economy, this Stabilization Act of 1942. What they said, benefits can bypass these caps, right? So one of those benefits being health insurance. So employers started to offer employer-sponsored health insurance. And then the IRS said, hey, it's tax-free. So then everyone was like, well, this is the way we're going to do things, right? I am very certain in 1942, they didn't expect all of the unintended consequences that would come out of making this decision. And one of the most detrimental consequences of this is that we, because of the nature of employer-sponsored healthcare in this country, we don't think long-term with regard to how we treat health. Because people leave jobs, they go to a different insurance company, companies churn plans all of the time, and no one wants to make a long-term investment in health because they can't get the ROI on it in a short enough period of time. Give you a perfect example. The anti-obesity medications, the GLP-1 drugs, one of the most phenomenal pharmacological breakthroughs ever. Companies don't want to pay for it for one reason. They say, I'm going to pay $1,000 a month for this drug right now, and then CMS, when this person gets on Medicare, is going to get the savings because the chronic conditions that it's going to prevent are down the line. So we've created a system where the incentive structures are all thrown off, and we have to do something about this. We have to. Because we spend more than any other country on the planet. About 18 to 20% of our GDP is spent on healthcare. That's more than twice any of the other industrialized nations on the planet. And again, you might say, well, this is America. We pay more and we get more. We don't exactly get more. If we look at any of the objective measures of how we would evaluate how our healthcare system is doing, we have lower life expectancy than our peer countries. So at the tail end of life, we live longer or we live short. We have higher infant mortality than all the other industrialized nations. So if you just think of the bookends of life, we are paying more than twice any other country on the planet, but we're doing poorly at birth and we're doing poorly at death. We also have a 50% higher preventable death rate than our peer nations, and 9% of our population, and this is as of right now, this isn't as the One Big Beautiful Bill Act becomes more ingrained and the Medicaid unwinding starts to occur. This number is going to go up, but 9% of our population is uninsured compared to 1% of peer nations, right? And I realize that probably everyone in this room has insurance, and so you might think, well, you know, how does that last one affect me on an economic level? Like on a human level, that's terrible, but on an economic level, that affects all of you because the people that don't have health insurance, they wait when they've got something going on, and then they end up in an ER, and when a condition is very severe, and it's uncompensated care for the healthcare system, and that drives everybody's healthcare cost up. So that number, as that number goes up and up and up, that's a 5-alarm fire that's going to continue to drive our healthcare costs. And this chart is probably, if you were thinking about the long-term, not just physical health of our nation, but the long-term economic health of our nation, this chart should scare you. Because what this shows is, by 2050, our healthcare costs are going to approach 30% of GDP, right? Now, in a world where there are finite financial resources, what starts to happen as our healthcare costs start to consume a larger amount of GDP? We're going to have to make some really hard choices. Are we covering healthcare? Are we covering education? Are we covering infrastructure? Are we covering military defense? Where's the money going to come from? So we have to bend this cost curve. Somehow we have to bend this cost curve. Now, switch gears, file for some employee engagement things. Then I want to get to solutions. Like, whenever I talk about healthcare, I always feel like it's so doom and gloom, and I'm gonna make sure everybody leaves here on a high note today, thinking they could do something about it. So what about employee engagement? This is a study from Gallup.
Excuse me, just a minute.
Yeah.
I encourage people to take photos, so we put them on social media.
And I'll also share, I have my email in the end of the presentation too, if anybody wants to email me and get that.
I'll have it through, I'll have the email in the whole presentation.
Perfect. See that this as well. But yes, please take pictures. So employee engagement. So you look at this graph and you go, okay, the 32% of employees, according to Gallup, are engaged, and 16% are disengaged. And so you look at those numbers and you're like, well, that's not good. But then I actually went a step further. I was like, okay, 32% are engaged, 16% are disengaged. There is another 52% that are just trying to net, right? Just trying to net. Like, is that really what we want at our workforce? I don't want people working for me or just like, meh. So 2/3 of employees, according to Gallup, and I don't know, if you can generalize this to the population as a whole, but that's an interesting number, right? So 2/3 are either disengaged or met. Gallup also has this engagement hierarchy. And I found this really, really interesting. And, it talks about basic needs, management, support, teamwork, and growth. And, that basic needs level, what do I get? I think I kind of look at this as very similar to the Maslow's hierarchy of needs. I mean, I think that's probably where they came up with this from. And, that physiological needs, that's your health, right? I mean, the mum things. But, like, your health is the base of, what do I get? And I think many employees that are looking at companies are looking at health insurance right now. It's like, what am I getting? What am I getting? Where does this actually mean? We just hired somebody who was 25 years old. She's just about to get off her parents' health insurance because you'd stay on your parents until you're 26. And the questions this young lady was asking me about health insurance, I was like, this is very interesting. Even 10 years ago, I wasn't getting these questions. So this is something that is in the consciousness. So I really think there needs to be a paradigm shift. And all of you are leaders in your organizations, even though you may not make healthcare purchasing decisions. If you're a leader, you influence what happens in the organization. And in terms of starting to pivot this presentation towards solutions, the first solution I would ask all you to make is a paradigm shift. Instead of thinking of employee healthcare as cost to be managed, think of it as an investment to be made. You're investing in the health of your people. If your people are not healthy, they cannot be productive, they cannot perform for you. It is an investment in the health of the organization. So, how do we get to healthy people? Well, we do it through the lens of addressing chronic disease. So, chronic disease, so I do not want to put my coffee on that. I ruined the piano. Chronic disease, which is diabetes, hypertension, high cholesterol, low back pain, depression, anxiety, all the things that ail our society. 80% of chronic disease is lifestyle. 80%, which means that $3.5 trillion of our $5.5 trillion healthcare spend has a lifestyle basis to what drives. Now, genetics certainly plays a role. Environment certainly plays a role. I'm not saying that's not the case. But lifestyle is a strong driver of chronic disease. And this is something that is becoming part of the consciousness for healthcare. And there is a medical association, it actually is the fastest growing medical association in the country, called the American College of Lifestyle Medicine. I do a lot of work with this group, particularly on the physical activity pillar of lifestyle medicine. They're also a board organization for the Physical Activity Alliance. And they have 6 pillars of lifestyle medicine: nutrition, physical activity, stress management, social connections, sleep, and avoiding risky substances. And I would submit to all of you that even if you addressed 1 or 2 of these pillars, you would see significant improvements in your health. And this organization actually has physicians that are board certified in lifestyle medicine that help people manage their lifestyle related issues as it relates to chronic conditions. Locally, Trinity Health has a lifestyle medicine practice that is amazing. They do some amazing work. There's a couple of lifestyle medicine physicians at Michigan Medicine. Corwell also has a big lifestyle medicine practice, even though that they're not here in the Ann Arbor area. So this concept of lifestyle medicine is not only something that is making its way into the consciousness of healthcare, but it's also starting to make its way into the consciousness of policymakers. Now, I'm going to start to talk about the concept of Make America Healthy again. So before I start that, I want to be unequivocally clear. I think our current Secretary of Health and Human Services has a lot of views that I absolutely do not agree with at a lot of levels. However, the fact that we have now brought into the national lexicon the concept of Make America Healthy, like that in and of itself is not a bad thing at all. Now, many of us could agree some of the ways that it might be happening might not be the best way to do it, and I'll just leave it at that. But we're at a moment where food as medicine is really getting a lot of momentum. The exercise in medicine movement that I'm involved with is really getting a lot of momentum. So there is this consciousness around how do we change lifestyle? How do we change lifestyle? I don't know if it's what they did with the new food guide pyramid. That probably not, but I think that this is a really interesting area. So I want to talk about some investment opportunities that we can all think about making when we leave here today. I'm going to break these down into really 3 categories. One is going to be kind of on the advocacy level. The next is going to be on the organizational level, and then finally on the individual level. So I want to talk about advocating for reform. One of the most amazing things about living in America is you can advocate for what you believe in. You could speak truth to power. I know nowadays that seems difficult and challenging, but that doesn't mean we should stop doing it. And so we should be advocating for reform to our healthcare system. We have to advocate for payment reform. We absolutely have to. Right now, our healthcare system is a fee-for-service system for the most part. That means the more stuff that they do to you, the more they get paid, right? Healthcare is not paid on outcomes right now. They're paid on things they do to you. And now, again, I want to be clear. This is not the fault of healthcare. It's the system that they're operating, right? And this is a really, how we got there is a really complicated thing I don't have time to talk about. But what I will tell you is we need to reform payment so we're paid for outcomes, right? Not for what's done, right? It would be like if somebody takes their car into a car shop and they just do a bunch of stuff with it. The car's not working well when they're done. They bring it back, and then you get to get paid more for it again, right? Instead of being paid on the outcome that you fixed the car, right? That's not how our healthcare system works. So we need to reform the system so we are paying for outcomes, not for tasks. We have to incentivize primary care to be a more critical part of our healthcare system. Somebody, or maybe it was you, Rob, said, normally try to get into a doctor and they would say, it's like 12 months from now, right? Primary care physician is your quarterback of your healthcare team, right? I hope everyone in this room has a primary care physician and sees them relatively frequently. I find often that is not the case, particularly for younger kids. There just aren't enough primary care physicians to go around.
What about what they also a nurse practitioner?
Yes, yes. All those people on the front lines that need to provide kind of the more basic levels of healthcare, the triage, the getting to specialists, they're out there in the quantities we need. Why? Because they're not paid enough. A primary care physician has to go to medical school, spend the same amount of money as a cardiothoracic surgeon. Cardiothoracic surgeon makes $600,000 a year. Primary care physician makes $150,000 a year. What's the economic decision that you're going to make, right? We also need to be thinking in terms of how we incentivize healthcare providers through our payment mechanisms to have conversations about nutrition, to have conversations about exercise. I won't get too deep into the policy weeds, but one of the things that we put in place at the Physical Activity Alliance are actually billing codes for physicians to talk about exercise with their patients, right? If you do not pay them to do it, they aren't going to do it because they can't, right? But they have to be able to make a living. So we need payment reform. We need to reform our built environment and our food system. We need to make our communities more walkable, more rollable. That absolutely has to happen. We're so blessed here in Ann Arbor to have the community that we have in terms of we have bike lanes, and I know the bike lanes have made some people mad. Like, I go, but like on balance, they're a good thing, I promise. I won't even get into our food system, but I mean, our food system in this country is predatory profiteer. Like, full stop. Full stop. I'm not Bernie Sanders, but I do believe that I believe, it's not the first stop. I believe we need a national healthcare system where it's universal healthcare. Like, we absolutely need that in this country. But we're not going to get there quickly, right? I do believe we need universal basic primary care in this country. I believe every single American needs a primary care physician that is backstopped by the government. If we could get to that, we would start to address a lot of what ails us from a healthcare perspective in this country. So I think we absolutely have to be advocating for that. And we can advocate for that. You can talk to your local representatives. You can talk to your state representatives. This is a really significant inflection point, healthcare in this country. Policymakers are listening because it is such a massive problem. Longest government shutdown in the history of the country happened over healthcare. Probably no one's talking about it anymore, right? Like, we need to raise that again. So I'm a very big proponent of advocacy. How benefits design? Maybe you're a purchaser of health insurance. Maybe you're a leader that can have conversations. Maybe you're an employee in an organization who can tell your leaders what you want from your insurance benefits. That'd be an interesting thing to do, right? I don't think anybody ever thinks of this until November rolls around and they get the new plan design and they're like, oh, what's this, right? So we need to reimagine the way we do benefits. I think direct-to-employer contracting, where an employer goes to a specific healthcare system and says, we want to work directly with you to keep our employee population healthy. I think that is one of the best ways to design a benefit plan, particularly if you can tether your direct-to-employer contracting with primary care physicians that do lifestyle medicine. Trinity Lifestyle Medicine locally here, they do a lot of great work. If you're an employer in the community and you're looking for a way to improve the health of your employees, and Trinity's not paying me a dime to say any of this, like, that's something I would look into. You can directly contract with healthcare entities, some you've heard of, some you've probably never heard of, then do this direct primary care model. You could consider centers of excellence networks. You're seeing this happen a lot. So for people who have heart disease, or people who have back issues, or people who have depression, or people who have anxiety, there are specific health systems and healthcare providers in this country that are widely recognized as doing that better than other providers based upon the outcomes they drive. And that is actually something that employers can contract with directly. And then driving and structuring your pricing around outcomes, not things that are done. Those are things that can actually happen from a benefits design perspective. Offering HSAs and FSAs, health savings accounts, flex spending accounts. These give people a decent amount of latitude with some of the money they spend. These are starting to evolve quite a bit. be in the physical activity space. Have been advocating for reform on HSAs and FSAs to allow them to be used for physical activity-related services, not just gym memberships, but sport leagues for kids and bikes and things like that. So HSAs and FSAs are a really interesting vehicle to give people a little bit more autonomy with their healthcare spend. The telehealth services for chronic condition management that are out there now are pretty impressive. And they all have kind of employer-sponsored arms to them. Headspace and Talkspace for mental health challenges. Noom and Livongo are two services that provide chronic condition management. So for diabetes, hypertension, obesity, GLP-1 support. And these are companies that will work with organizations of any size to stand up a program that can be really, really effective to manage employee health. And exploring benefits brokers who are a little more wellness-minded, I'll just say. If you're somebody who's involved in healthcare purchase decisions, you have a benefits broker, talk to them about some of these things. Are they in the know about the ways to address chronic conditions through lifestyle, or is it just the standard, get a healthcare plan, make sure everyone knows what doctor they can go to, make sure the pharmacy benefits look reasonable, and move on? So doing a little due diligence. Now, again, I think two hands went up on making the healthcare purchasing decisions for your company in this room. But that doesn't mean you can't advocate for these kind of things to your employee, right? You can go to your HR department and what about this or what about that? All right, so let's get to the last level here, the culture or the environment level. You're all leaders. People watch what leaders do. They watch what leaders do more than other people in the organization. If you want your workforce to be healthy and engage in these health behaviors, then the first person to start with is yourself, right? Model lifestyle behaviors and make yourself a healthier person. Even if nobody follows you, you'll still be in a better place for it at the end of the day. Developing a wellness committee is a great thing that you can do in an organization. I guarantee you, no matter what size of your organization, you have some people that are passionate about health and wellness. And they'll serve on these wellness committees for free. They don't want this is not part of their job. They just want to make people healthier. We all know those people in our organizations, right? They're the crazy person who gets up, he sees a from the morning and runs. That is the person that would lead one of these groups. And then I think we need to create an environment that is lifestyle medicine friendly. How do we have healthy food in our cafeteria instead of, cakes and cookies and things like that? With all due respect to the Zers. How do we create an environment where we can get people moving more, right? How do we create movement breaks during our day? What can we do from an environmental and a cultural perspective to ensure that we have a healthier workforce? These are things that every single one of you can do in this room, even if you're not a formal high-level leader in your organization. Instead of having a bowl of candy out of your desk, you could have a bowl of fruit out of your desk, right? Little things make a difference. Little things shape a culture. So I can't end this as an exercise physiologist. They'd take my union card away if I didn't talk a little bit about movement. So I'm going to talk a little bit about movement, and then I will open it up to questions. I actually don't know how much time I have. So,
And we got about 25, 30 minutes.
Perfect. Oh, great. All right. Well, if I talk about this, then I can open up the questions for about 15 minutes.
Now, I've got issues I don't want to do with it a bit. So,
Like an actual physical exercise?
yeah. Oh, yeah. No.
Oh. What's your Rob going to ask? All right. So let's talk about this. Let's talk about building a movement of movement in our organizations. And so when I talk about this, I want to be really, really clear. And I'll frame this up like this. I literally have made all of my money in my professional life helping people exercise. That's where I made my money. But I'm going to say unequivocally, I vote to exercise, but exercise is just the icing on the cake. And I think sometimes we forget about this. There's a big difference between physical activity and exercise. What I'm doing right now, moving around up here, flailing my arms, all that stuff, this is physical activity, right? Going for walks, physical activity, playing with your kids is physical activity. Physical activity is the key to health. Physical activity improves your health. Exercise improves your functional capacity, right? And I think we really get the message wrong as a physical activity and exercise community when we talk about telling people they have to exercise. They have to go from doing very little to no physical activity all the way to exercise. That is a bridge too far for a lot of people. So reducing sedentary time, so moving more and increasing physical activity, kind of same two sides of the same coin, are the best way to integrate movement into your life. So I'm an exercise physiologist. I own an exercise company that makes money from people exercising, and you're hearing from me curse. I actually don't care if you start by exercising. I care that you start moving more, just being more physically active. And from there, then maybe you could start to get into exercise if that's something that interests you. Exercise is beneficial, but it improves function. Physical activity improves health. So what does this look like exactly? Well, this is a great study that was published back in 2023 that looks at steps at all-cause mortality. So what I want you to look at on this graph, and where you see several graphs that look very, very similar to this, is as people go from 0 steps a day down to, all the way up to 20,000 steps a day, you see this kind of curvilinear decrease in mortality. But the most significant part of this graph is the part that exists from 0 to 5,000 steps. Look at that reduction in mortality rate going from not moving much at all to just moving a little bit more. So the whole 10,000 steps per day thing, I think now that's becoming more broadly recognized as a little bit of a myth. This study suggested, it's not that going from 5,000 steps and 10,000 steps per day doesn't make a difference in mortality, but it makes a much smaller difference than going from 2,000 steps to 5,000 steps. It's probably going to be hard for everyone to see this from way back there, so I'll just interpret this graph for you. This graph looks at all-cause mortality as it relates to a series of risk factors. And this was a study published back in 1989 by Stephen Blair, who's a world-renowned exercise physiologist. And it found that low aerobic fitness was a bigger predictor of mortality than cigarette smoke. It was also a bigger predictor of mortality than high blood pressure, high cholesterol, and high BMI. Low aerobic fitness is a bigger predictor of mortality than cigarette smoke. Wow. Yeah, wow, exactly. It's just kind of interesting, right? Like, you see the people who are like outside the restaurant in the middle of January smoking, and you're like, what is that person doing? Like, does anybody smoke anymore? Yeah. And yet, lower aerobic fitness, bigger predictor of mortality. Now, what this does not say is because invariably somebody says this or thinks this. Well, does that mean if I am rookie but I smoke, it's going to be okay? So this is some additional research also done by Stephen Blair that looks at aerobic capacity and mortality. And we see a really interesting relationship in this graph, similar to what we saw in the couple graphs back. We see that somebody goes from low aerobic fitness to high aerobic fitness, that their mortality decreases. Like we're not surprised by, right? What we should be surprised by is the difference between the lowest level of aerobic fitness and the second lowest level of aerobic fitness in terms of mortality. For men, it cuts it more than in half, and for women, it cuts mortality in half by going from the lowest level of aerobic fitness to the second level of aerobic fitness. Let me put that in really simple terms. What this says is, if you go from really, 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 really out of shape to just really, really, really out of shape, take out one really, you drop your mortality rate. It's funny. It's funny, but it's also profound, right? Like, I was popping to a young lady here earlier, told me she was going to do her first the half Ironman. Who's my half Ironman for us? Yes. So you do not have to be a half Ironman person, which is an amazing thing. Iron woman in this case, to get your mortality rate to go down. You just have to get a little bit more fit. And so I actually came up with this concept of flagging the curve way before Anthony Fauci. So he stole this from me, not the other way around. And the relationship that you saw on all of these graphs, and this is true for any health behavior, not just exercise. If you're eating really, really, really poorly, and then you just start to eat really, really poorly, you're going to see a bigger benefit to your health than if you eat really, really well, and then you add one more really to it, right? It always occurs when you're going from nothing to something. That's the biggest difference. So with movement, this is what we know. You don't have to go from being a couch potato to be a jack potato to really improve your health. You just got to be a slightly more active potato. And you could laugh it. And beyond being amazed by my ability to find the exact kind of clip art, but so you can imagine how long it took me to find. Cameron probably would. What's he doing back in his office all day long? It's, Chat GPT, find data flexing potatoes. The most comfort part of this graph is that curve right there. Right. It's going from very little to no physical activity to just a little more physical activity makes a difference. And I say that in the context of this presentation, for you as individuals and you as leaders in your organization, you're not telling people they need to get to 150 minutes every. I talk about this a lot with our federal partners at CDC, and they fully understand this. Like this 150-minute thing that's kind of turned into a little bit of a binary, like 150 minutes good, 149 minutes bad, is really, really poor public health message, right? The reality is going from 0 minutes to 20 minutes is infinitely more impactful than going from 100 minutes to 200 minutes. It just is, right? And so for you, or the people you work with, the people in your family, you get whatever health behavior you want to capital, sleep, reducing your risky substances, social connection, nutrition, movement. It's not going from where you're at all the way over to what the wellness influencers want you to do. It's just moving the needle a little bit in the positive direction on any of the health behaviors that are a part of lifestyle nuts. Again, I would submit to you that on a minute-by-minute basis, you're going to get a lot of bang for your buck from moving. All right, you just are. But pick anywhere it stops. So, in closing, what's my call to action for all of you? Well, using this socio-ecological framework that I presented, figure out the level that you want to make change on. And if it's only on the individual level, if it's only you committing, then this isn't great because it's getting nicer out. So it's a committee of taking a 5-minute walk once every single day. Right? I mean, that's a significant increase to your physical activity. Start on that level. So prioritize your own health. If you don't have your health, you don't have anything. Reimagine your benefits. Either you're the purchaser of that or you're somebody in your organization that's advocating for benefits that are in alignment with some of the things I talked about today. How are we addressing lifestyle with our benefits? How are we getting upstream of the problem rather than addressing it after it's already been a problem? Try to find one investment that I suggested to make today and make it, even if it's an investment in yourself. And then lastly, advocate for healthcare policy reform. Do not become cynical around this. Do not think it is too big of an issue to change. I think the great thing about our country is if there's a loud enough voice, we can change anything. And now is that moment for healthcare. Now is that moment. So don't let that moment pass us by. We desperately, desperately need it. I hit the button again. So that is my contact information. Those are the organizations I'm involved with. Happy to answer any questions that anybody has, but thank you guys so much.